everyone, I am Christine Jane Medaz and now I am going to discuss about sexually transmitted diseases or STDs. So STDs are generally acquired by sexual contact. The bacteria, viruses, or parasites that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mothers to their infants during pregnancy or childbirth, or through blood transfusion or shared needles. STDs don't always cause symptoms. It's possible to contract sexually transmitted infections from people who seems perfectly healthy and may not be even know they have an infection. That is why STDs are dangerous because they are easily spread and it is hard to tell just by looking who has an STD. So STDs are diseases and infections which are capable of being spread from person to person through sexual intercourse, oral genital contact, or in non-sexual ways, in IV drugs, and congenitally transmitted.
Good day everyone, I am Rinald M. Pascual and we are now discussing the STD contributes to reproductive functions. Infertility in women and men can be caused directly or indirectly by sexual transmitted illnesses. When STDs go untreated, infections can move up to the reproductive system causing damage, scarring, and inflammations in the uterus, ovaries, and fallopian tubes, resulting in infertility. In addition, infection with an untreated STD can harm the anatomy of male reproductive systems, particularly the epididymis and urethra. There are many types of STDs, but there are some common STDs. First is the chlamydia. Chlamydia is a common sexually transmitted disease that caused by a bacteria called Chlamydia trachomatis. Once a person is infected, they can spread chlamydia through their partners through intercourse, anal sex, or oral sex. Infections can also occur when partners share sex toys that have become contaminated with bacteria responsible for chlamydia. It can cause permanent damage to women's reproductive system. This can make it difficult or impossible to get pregnant later. Chlamydia can also cause potentially fatal ectopic pregnancy. A pregnant person with a chlamydia can give the infections to their baby during childbirth. Next is the gonorrhea. A gonorrhea is a sexually transmitted disease caused by the bacterium Neisseria gonorrhoeae, a bacterial infection that is also called the clap or drip. You can get infections when the bacteria enter your body through the penis, anus, vagina, or mouth, often during unprotected sex. In women, most common site of infection is the cervix. The cervix is the opening from the vagina to the uterus. In men, the infection tends to start in the urethra, the tube that helps urine exit the body. The disease that is most common in people ages 15 to 30. The next common STD is syphilis. It can cause serious health problems without treatment. Syphilis is caused by the bacteria Trypanomia pallidum. You get it through direct contact with the syphilis sore in someone else's body. This usually happens during sexual activity, but the bacteria can also get into your body through cuts on your skin or through your mucous membranes. Infection develops in stages: primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. Syphilis was once a major public health threat, and it can cause serious long-term problems such as arthritis, brain damage, and blindness. There wasn't an effective treatment until the late 1940s when the antibiotic penicillin was developed. And last common was the HIV or AIDS. HIV is a human immune deficiency virus, is a virus that attacks the body immune system. If HIV is not treated, it can lead to AIDS, acquired immune deficiency syndrome. HIV infection in humans came from a type of chimpanzee in Central Africa. Biological changes caused by HIV, including systemic illnesses, stress, and weight loss, may affect the functions of reproductive organs and result in infertility. Newly diagnosed HIV infection may cause by psychological trauma and decrease in sexual drive and sexual activity. HIV has a myriad of effects on the sexual and reproductive health of both men and women. HIV virus attributes infections in the male genital tract, where the semen remains the main vector in the transmission, and the further infection leads to replications of viral load that affects the semen and sperm parameters, which may cause male infertility.
That's all for my report. Shane Mintal, please take it away.
Good day everyone, I am Shane Mintal and I'll be discussing the contemporary use of testing to diagnose and treat STDs. Getting tested for STDs is a basic part of taking care of your health. Most people with STDs don't have any symptoms. Testing is the only way to know for sure if you have one. Testing is usually quick and painless. It can be easy as peeing in a cup or rubbing your cheek with a swab. And if you do have an STD, it's better to find out early because you could spread the infection to other people you have sex with.
Here are the tests for the most common STIs or sexually transmitted infection. First, we have chlamydia and gonorrhea. The Centers for Disease Control and Prevention recommends chlamydia and gonorrhea screening for sexually active women aged 25 or younger, pregnant women, women and men at high risk. The tests include a urine test. A sample of your urine is analyzed in the laboratory for presence of this infection. A swab. For women, your doctor takes a swab of the discharge from your cervix for culture or antigen testing. Antigen tests are methods of detecting an active infection through the patient's nose and throat, but some women prefer to swab their vaginas themselves, which has been shown to be as diagnostic as doctor obtained swabs. For men, your doctor inserts a slim swab into the end of your penis to get a sample from the urethra. In some cases, your doctor will swab the anus. Next one, we have syphilis. Most forms of syphilis testing look for syphilis antibodies. Syphilis antibodies are substances in the blood that are made by the body's immune system in people who come into contact with the bacteria that causes syphilis. Several types of antibody blood tests may be used to detect a syphilis infection. Syphilis can be diagnosed by testing samples of first we have blood. Blood tests can confirm the presence of antibodies that the body produces to fight infection. The antibodies to the syphilis-causing bacteria remain in your body for years, so the test can be used to determine a current or past infection. Next, we have cerebrospinal fluid. It is a cushion that protects the brain and spine from injury. If it is suspected that you have nervous system complications of syphilis, your doctor may also suggest collecting a sample of cerebrospinal fluid through a lumbar puncture. It is performed in your lower back, in the lumbar region. During a lumbar puncture, a needle is inserted into the space between two lumbar bones to remove a sample of cerebrospinal fluid. The recommended antibiotic treatment for adults and adolescents with primary, secondary, or early latent syphilis is benzathine penicillin G 2.4 million units in a single dose, while in late latent syphilis or latent syphilis of unknown duration is benzathine penicillin G 7.2 million units as 3 doses of 2.4 million units each at weekly intervals. The treatment recommendation for neurosyphilis, ocular syphilis, or otosyphilis is aqueous crystalline penicillin G 18 to 24 million units per day, administered as 3 to 4 million units every 4 hours for 10 to 14 days. Next, we have trichomoniasis. Many people with trichomoniasis don't have any signs or symptoms. When symptoms do happen, they usually show up within 5 to 28 days of infection. Both men and women should get tested if they have symptoms of an infection. Trichomoniasis testing looks for evidence of the parasite Trichomonas vaginalis. Several laboratory tests may be used to detect trichomoniasis. The test method selected for an individual depends on their anatomy and test availability. In women, first we have swab taken from the posterior vaginal fornix at the time of speculum examination. Your provider will take a sample of discharge and/or cells from your vagina using a small brush or swab. The sample will be placed on a special slide. A laboratory professional will examine the slide under a microscope and look for parasites. Next, we have self-taken vaginal swabs produce similar results to clinician-taken samples when using nucleic acid amplification test for diagnosis. Lastly, we have physical exam. This exam includes a pelvic exam. It is an exam or way for healthcare providers to look for signs of illness or disease in a woman's body. The pelvic refers to the organs in the pelvis. The exam is used to look at women's uterus, cervix, vagina, fallopian tubes, ovaries, bladder, and rectum. In men, we have first void urine using nucleic acid amplification testing. Your healthcare provider will also do a visual exam of your penis and may use a swab to take a sample from your urethra. Recommended antibiotics for trichomoniasis are metronidazole and tinidazole. Lastly, we have genital herpes. Tests for HSV are most often done only for sores in the genital area. The test may also be done using other types of samples such as spinal fluid, blood, urine, or tears. First, we have viral culture. These tests involves taking a tissue sample or scraping of the source for examination in the laboratory. Your doctor will need to collect a skin sample at the height of your outbreak. For skin lesions, you may feel a scraping sensation. If your lesion is located in your throat or eye, a sterilized swab must be used for sample collection. Next, we have polymerase chain reaction test. It is used to copy your DNA from a sample of your blood, tissue from a sore or spinal fluid. The DNA can be tested to establish the presence of HSV and tell the difference between HSV1 and HSV2. Lastly, we have blood tests. These tests analyzes a sample of your blood for the presence of HSV antibodies to detect a past herpes infection. Antibody tests are sometimes done but are not as accurate as a viral culture at finding the cause of a specific sore or ulcer. Antibody tests cannot always tell the difference between a current active herpes infection and a herpes infection that occurred in the past. Because antibodies take time to develop after the first infection, you may not have a positive antibody test if you have just recently been infected. And that is all for my report. Thank you for listening.
Hello everyone, this is Apple Pulikit and we will going to review some major infections and example of STDs and their appropriate treatment or therapy. So some STDs bacterial infection include chlamydia, gonorrhea, and syphilis, while some viral infection it includes human papilloma virus, which is known as HPV, and herpes or herpes simplex virus, and the human immunodeficiency virus, acquired immunodeficiency syndrome, which is known as HIV or AIDS, and the last is hepatitis. Let's first know the bacterial vaginosis. So, it is a common, treatable, and vaginal condition which can increase your chance of getting an STD. So, let's proceed to its symptoms. So, up to 84% of people with bacterial vaginosis don't have symptoms. If you do, you may have off-white, gray, or greenish color vaginal discharge fluid, or discharge that smells fishy, which fishy smell that is strongest after sex or during the menstrual cycle, and rarely an itchy or sore vagina. For its treatment, your doctor will prescribe antibiotics, which is typically metronidazole or clindamycin. So this medication come in a gel or cream you insert into your vagina, and they also come in pills that you can take orally. Let's proceed to chlamydia. So chlamydia is a common but treatable STD. If it left untreated, chlamydia can make it difficult for a woman to get pregnant. So its symptoms. So if you do get chlamydia symptoms, they usually show up within 1 to 3 weeks after contact. So, chlamydia symptoms in women. So, they commonly experience abnormal vaginal discharge that may have an odor, bleeding between periods, have painful periods, and abdominal pain with fever, pain when you have sex, and itching or burning and or around your vagina, and pain when you pee. Then, chlamydia symptoms in men. So, they commonly experience small amounts of clear or cloudy discharge from the tip of their penis. So, they are also experiencing painful urination and burning and itching around the opening of the penis, and pain and swelling around your testicles. So, its treatment, the two most commonly prescribed antibiotics for chlamydia are doxycycline, whereas it is taken every day for a week, and azithromycin, which is one dose of 1 gram followed by 500 mg once a day for 2 days. Now let's proceed to gonorrhea. So gonorrhea is a common STD that can be treated with the right medication. If it's left untreated, gonorrhea can cause very serious health problems. Because untreated gonorrhea can lead to long-term health concerns and in some cases, infertility. Now let's see its symptoms. So many people with gonorrhea have no symptoms. Those who do often experience a burning sensation during urination. So in male or a person with a penis might also notice white, green, or yellow discharge, pain or swelling in the testicles, and inflammation or swelling of the foreskin. While in female or a person with a vagina might have increased vaginal discharge and bleeding between periods. Also, rectal symptoms may occur if a person has anal sex. So this may include discharge, itching around the anus, soreness, bleeding, pain during bowel movements. For its treatment, modern antibiotics can cure gonorrhea in most cases. And also, prevention recommends that uncomplicated gonorrhea be treated with the antibiotic called ceftriaxone, given as an injection, and with oral azithromycin. Now let's proceed to hepatitis. Viral hepatitis is the leading cause of liver cancer and the most common reason for liver transplant. Its common symptoms of infectious hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, and yellow skin, eyes, which may be sign of jaundice. Treatment. Treatment for hepatitis varies depending on the type and severity of the disease. And clients who have any form of viral hepatitis will benefit from resting, avoiding alcohol and discontinuing drug use, avoiding other substances that can harm the liver, including acetaminophen in large doses, and eating nutritious and well-balanced meals, and getting vaccinated against hepatitis A and hepatitis B. Herpes. Genital herpes is a common STD, but most people with the infection do not know they have it. While there is no cure, there are medicines available that can prevent or shorten outbreaks. This medicine also can make it less likely to pass the infection on. So for its treatment, there are 3 antiviral medications that are FDA approved for the treatment of genital herpes. It is the acyclovir, valacyclovir, and famciclovir. There are also 2 kinds of treatment regimens. It is the episodic therapy and the suppressive therapy. Episodic therapy is the early treatment for recurrences, and suppressive therapy that consider taking an antiviral drug every day. Also, suppressive therapy can reduce the number of outbreaks by 70% to 80%. So there are also home remedies and lifestyle. At-home treatments for herpes are used to relieve the pain. They do nothing to alter the course of the infection but can make you more comfortable as the herpes sore begins to heal. So the common things that you will going to do is use a cold compress, do not touch or scratch, keep the sore clean, and reduce stress. HIV and AIDS. So people who have STDs are more likely to get HIV when compared to people who do not have STDs. And the most dangerous viral STD is human immunodeficiency virus or HIV, which is commonly feared by many because it leads to AIDS. Also, HIV infection weakens your immune system, making you much more likely to develop many infections and certain types of cancer. For its treatment, HIV is treated with a combination of medicine, pills taken by mouth every day. This combination of pills is called antiretroviral therapy or ART. The goal of ART is to reduce HIV in the blood to an amount that's not detectable by an HIV test and to slow HIV's weakening of your immune system. Also, taking a combination of types of pills rather than just one is the more effective way to keep HIV from multiplying and destroying your cells.
So now let us know what are the strategies for lowering the risk of sexually transmitted infection or diseases. So first is practice abstinence. The surest way to avoid STDs is not to have sex. Use condoms. Using a condom correctly every time you have sex can help you to avoid STDs. And third is have fewer partners. Agree to only have sex with one person who agrees to only have sex with you. Get vaccinated. The most common STDs can be prevented by a vaccine. The HPV vaccine is safe, effective, and can help you avoid HPV-related health problems like genital wart and some cancers. And lastly is talk with your partner. Talking with your partner about the STD and staying safe before having sex. So that's it for my report. I hope you learned something.